The health and safety of our employees, contractors, and visitors are of the utmost importance. The COVID-19 impact to society and the mitigation strategies, such as social distancing and shedding prevention, have impacted how work is performed across the country. As a result, this training provides guidance for protecting anyone that requires working indoors, in close contact with others, or sharing common workspaces. We hope to minimize the risk of exposure, illness, and spread of the disease. Thank you in advance for your willingness to adopt the safety measures that are presented in this training. Together, we can break the chain. COVID-19 is caused by a new coronavirus, SARS-CoV-2. Coronaviruses are a large family of viruses that are common in people and in many different species of animals. The complete clinical picture of COVID-19 is not fully known. Reported illnesses that range from very mild, including some people with no reported symptoms, to severe, including illness resulting in death. The virus spreads mainly from person to person, between people who are in close contact with one another, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouth or nose of people who are nearby and possibly be inhaled into the lungs. You may also contract the virus by touching a surface or object.
A cloth covering to cover your nose and mouth when near other people, working indoors, and sharing a common work area or surface. This is to protect the people around you. You still may be infected, but do not have symptoms. Knowing the pros and cons of different face coverings will help you understand why a face covering is more appropriate for certain circumstances. You may not feel sick, but you could be asymptomatic. No one knows for sure if they are carrying the virus. Wearing the face covering protects others from you, and in return, they are protecting you from them. Face coverings must cover your nose and mouth. You want them to fit snugly but comfortably against your face. Remember to make sure they are secured with ties, bands, or ear loops. Face covering should include multiple layers of fabric while still allowing for breathing without any restriction. They also should be able to be laundered without damage or losing shape. When putting on and taking off your face covering, take care not to touch your eyes, nose, or mouth. Wash or sanitize your hands after handling your mask. Let's work together to ensure that N95 masks and surgical masks are available for healthcare providers working on the front line of defense against the virus.